Good morning. Today is Friday, May 15th. My name is John Kinseth. I'm the Deputy City Manager here in Decatur. I'd like to talk today about where we are and where we're going. So we have 2 weeks left before the end of the governor's order. The city of Decatur and Macon County certainly anticipates that we will be able to move from phase 2 to phase 3 on May 29th based on the health metrics that we see today. As of yesterday, there are 158 confirmed cases of COVID-19 in Macon County, 6 people hospitalized, and there have been 16 deaths. As part of the governor's 5-phase reopening plan, if the Macon County can meet certain health metrics, we will be allowed to move from phase 2, which began on May 1st, to phase 3 on May 29th. What that means is that offices, salons, barbershops can begin to reopen as of May 29th. That is what we are anticipating, and that's what we are hoping for. Face coverings will still be required. Gatherings of more than 10 will still be prohibited. And so there will be certain things that are different than the way it was before. But it's a plan for a gradual reopening. What this means is that we all have to do our part. Everybody needs to wear their face coverings, maintain the social distancing and other CDC guidelines so that we can all do this together. At the end of the day, if there is a surge of COVID-19 cases, then the economy will likely have to contract, and some things that we have come to accustomed to being reopened potentially would have to re-close again. That is not the desire. The desire is to keep our rate of spread at a level that is manageable at the hospitals that we have, and so that we can have a sustained reopening moving forward and not have to re-enter a stay-at-home order. Another thing I'd like to talk about is that as starting next week, the city of Decatur has secured a number of these masks that we will start to provide for our population that doesn't have access to facial coverings. So people that ride the public transportation system will have access to these masks for free. Our homeless population and a number of our community organizations will work with the city to help distribute these masks to the people that need them. Certainly there are a number of retailers around town that you can buy face coverings, and we encourage you to do so if you have the ability to do so. But if you don't, then certainly you can count on the city to help provide that for you as we move forward. Again, we are all in this together. We need to do our part. That includes the face covering. So please, if you're medically able to, please wear the face covering when going into businesses, and let's maintain our social distancing, and together we can survive the next 2 weeks and hopefully move from phase 2 to phase 3. Thank you.
Hi, my name is Johnny Snegra, and I am an assistant professor at the SIU Center for Family Medicine in Decatur, and I'm glad I have this opportunity to talk to all of you in the community of Decatur about our perspective on the COVID-19 epidemic. A lot of our colleagues have been saying, a lot of important things about the epidemic, a lot of procedures to take care of yourself at home, and a lot of important data to share with you regarding our community. I thought I'd like to take it a level up and also talk a little bit more about what ways we can be more involved in our community and lay out a little bit of hope for Decatur and Macon County during this time. Now, in our current state, we have been doing a lot more tests, so a lot more cases are coming out because we are doing more tests in our community. It doesn't mean necessarily that there's more COVID-19 that's out there. We're just finding out more people who have the disease itself. And, regarding all of our resources regarding hospitalizations, we are using a lot of ICU beds and hospital beds for folks who are hospitalized with COVID-19 across the state. But we still have a decent amount of resources to take care of those who might be coming in, who might be discovered to have COVID-19 in the future. The governor currently has a stay-at-home order, which all of us as medical providers, all of us support the stay-at-home order that currently is in place by the governor, and supporting social distancing, being 6 feet apart from folks who, other people who might be around you, and also wearing a mask when appropriate to protect you and also protect potentially yourself against getting COVID-19. Now, with even all of the stuff that you hear about in the media, there is a degree of uncertainty that might be out there. You might be wondering what's right out there on social media, what might be correct you hear on the news, what is right or what is wrong. I will tell you that there are a lot of trusted sources that are out there. Look at the Macon County Health Department website, the Illinois Department of Public Health. Look at the City of Decatur website, and even talk to your local medical provider about what the facts are about COVID-19. We all are wanting our state to reopen, and are looking to find the right time when our state will reopen economically. And as presented previously by the City of Decatur and by our government sources, everyone is working to put the medical data together correctly to find the correct time for when the state is to reopen, so everyone can be prosperous at the right time. Everyone's working together toward this, and I want to make a shout out to those who are in the City of Decatur working towards the community as essential workers, those who've been working in grocery stores, those who've been working for food service, whether or not it's in the hospitals or whether or not it's fast food or restaurants in the area. I want to say thank you for those who are working in maintenance and sanitization in the area. I also wanted to give a thank you to those who are operating for our mail delivery and our shipping. All of you guys are a quintessential part of our infrastructure and keep our society running. But I also wanted to give a huge thank out, because this week is healthcare nursing week. A huge shout out to our nurses, who are our backbone to our medical community. They are our workhorses. They are the people we depend on. And so please give a thank you to a nurse, whether personally or if you know them personally, or if you're working with one, please say thank you to them this week. It's good to see our community take care of each other, not only through working together, but also donations to food banks, supporting local businesses more frequently. I've seen people go out their local businesses and also tip more because they want to support their local workers. They tip just as much as they would if they were dining in. They also have been making masks for each other, which has been great to see. This community has definitely come out for each other in the last month or so. And not everyone is alone. There are mental health hotlines that are out there for folks who need to be outreached to. And please outreach to the folks who might be lonely, your loved ones. If you can stay, again, social distancing, make sure you're observing social distancing 6 feet apart. There is hope that's out there. Things are starting to open up. As much as we still have the stay-at-home order, state parks are opening up. More restaurants are opening up. Some businesses are even opening up just a little bit, again, following guidelines. And it's great to see that. And we also have to be thankful for technology. What would we do without video conferencing or online grocery delivery and pickup? This world would be a completely different place without it. But working together, working with our government agencies, we will get through this together. And this is why we are at Limitless Decatur and Macon County. Thank you very much for this opportunity to speak to you today.